stop. Before you swallow that pill tonight, watch this. Because what I'm about to tell you could be the difference between healthy kidneys and a life sentence on dialysis. Every single day, millions of people take a common pill. A pill that's sitting in almost every medicine cabinet in the world. A pill that doctors recommend. A pill that you've probably taken dozens of times without a second thought. And here's the terrifying part. It's slowly, silently destroying your kidneys, and most people don't find out until it's too late. I'm talking about permanent damage. Irreversible damage. The kind where your kidneys stop filtering your blood, and machines have to do it for you. 3 days a week, 4 hours a session, for the rest of your life. Still think that pill is harmless? My name is Dr. James Harlow. I've spent over 22 years in nephrology, or that's kidney medicine. I've sat across from patients, good people, healthy people, people who did everything right, except for this one thing, and I've had to look them in the eye and say the words no doctor ever wants to say. Your kidneys are failing. The number one cause. It wasn't genetics. It wasn't diabetes. It wasn't even high blood pressure. It was a pill. A pill they trusted completely. Today, I'm going to expose the top 5 pills that are silently damaging your kidneys right now. We're going to go from concerning to absolutely shocking. Because number 1 on this list, I guarantee, is in your home at this very moment. And by the end of this video, you're going to know exactly what to do to protect yourself, to protect your family. But first, I need you to pay very close attention. Because the pill at number 1, 600 million people take it every single month, and the pharmaceutical industry does not want you connecting these dots. The damage doesn't happen overnight. That's why it's so dangerous. Your kidneys are silent organs. They don't scream in pain when they're being destroyed. They quietly lose function. 10%, 20%, 30%. And by the time you feel something, you've already lost too much. One study published in the American Journal of Kidney Diseases tracked over 10,000 patients over 10 years. What they found sent shockwaves through the medical community. Regular use of certain over-the-counter and prescription pills was directly linked to a 40% increased risk of chronic kidney disease. 40%. And these weren't sick people. These were regular adults, people like you, taking pills they thought were completely safe. So stay with me, because this list could literally save your life, or the life of someone you love. Let's start with number 5. Number 5 on our list. And this one surprises almost everyone who hears it. Antacids. Yes, the little tablets you chew after a heavy meal. The ones you grab at the gas station. The ones marketed as completely harmless. The ones with the friendly pastel colors and the fruit flavors. Those antacids. Specifically, the ones containing calcium carbonate. Brands like Tums, Rolaids, and dozens of generic versions sitting on pharmacy shelves right now. Here's what happens inside your body when you take too many of them. Your kidneys are responsible for filtering calcium out of your blood. That's their job. Every time you flood your system with high doses of calcium carbonate, your kidneys go into overdrive. They're working harder than they should, filtering more than they were designed to handle. Over time, this leads to a condition called hypercalcemia. Too much calcium in the blood. And when calcium levels stay elevated, it starts depositing inside the kidney tissue itself, like limestone building up inside a pipe. The medical term is nephrocalcinosis, and once calcium deposits form inside your kidneys, they don't go away easily. I had a patient, a 47-year-old teacher named Margaret. Margaret had chronic acid reflux. For years, her solution was simple. She kept a giant bottle of Tums on her desk. She'd take 4, 5, sometimes 6 a day, every single day, for 3 years. She came to me complaining of fatigue and mild back pain. She thought it was stress. She thought it was her mattress. It wasn't. Her kidney function had dropped to 61%, and the imaging showed early calcium deposits in both kidneys. She was devastated. She said, "Doctor, it's just antacids. They sell them next to the candy bars." That's exactly the problem. The fix? If you have regular acid reflux, don't self-medicate with calcium-based antacids long-term. Talk to your doctor about safer acid management options and never exceed the recommended daily dose, ever. Now let's move to number 4. And this one is going to make a lot of people uncomfortable because number 4 is something millions of people take every single morning. Proton pump inhibitors, PPIs. You know them by their brand names: omeprazole, pantoprazole, Nexium, Pralisec, prescribed for acid reflux, ulcers, GERD, stomach protection. Doctors hand these out like candy, and patients take them for years, sometimes decades, without ever questioning the long-term effects. Here's the science. PPIs interfere with the body's magnesium absorption. And magnesium, most people don't realize this, is absolutely critical for kidney function. Your kidneys use magnesium to regulate inflammation, control cell repair, and maintain healthy filtration pressure. When magnesium drops too low, a condition called hypomagnesemia, your kidneys lose their ability to protect themselves from inflammation. And inflammation is the silent killer of kidney tissue. A landmark study from JAMA Internal Medicine, one of the most respected medical journals in the world, followed over 170,000 patients. The findings were damning. People taking PPIs long-term had a 20 to 50% higher risk of developing chronic kidney disease compared to people who didn't take them. 20 to 50% higher risk. From a pill most people consider completely routine. I remember a retired engineer named David, 63 years old. He'd been on omeprazole for 11 years. His gastroenterologist kept renewing the prescription. No one ever stopped to question it. When David finally came to me, his kidneys were functioning at 54%. Stage 3 chronic kidney disease. He looked at me and said, "I took that pill every morning with my vitamins. I thought I was being healthy." That sentence has never left me. The fix? If you're on a PPI, ask your doctor today whether you still need it. Many people are kept on PPIs far longer than necessary. Lifestyle changes, dietary adjustments, and safer short-term alternatives exist. Don't just stop them cold turkey, but start the conversation immediately. Because the longer you wait, the more kidney function you lose. And you cannot get it back. And if you think numbers 5 and 4 were alarming, wait until you hear what's coming next. Number 3 is a pill that billions of people take for pain relief, and the damage it causes to your kidneys is so well documented, so undeniable, that researchers have given it its own medical name. You're going to want to hear this. Number 3, this one is not a secret. The research has been out for decades. The warnings exist, the studies are clear, and yet, people still take this pill by the billions every single year. NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac, aspirin in high doses, Advil, Motrin, Aleve, pills you buy without a prescription, pills you take for a headache, a backache, a sore knee after the gym, period cramps, a hangover, pills that feel so normal, so harmless, that people don't even consider them real medicine. But inside your kidneys, they are a slow-moving disaster. Here's the science, and pay close attention because this is important. Your kidneys rely on specific chemicals called prostaglandins to regulate blood flow through their tiny filtering units, called nephrons. Prostaglandins keep the blood vessels inside your kidneys open and relaxed, flowing freely. NSAIDs work by blocking prostaglandins. That's how they reduce pain and inflammation throughout your body. But when you block prostaglandins in your kidneys, blood flow drops, pressure drops. The nephrons, your kidney's 1 million microscopic filters, start to starve for oxygen, and starved nephrons die. They don't recover, they don't regenerate. Once a nephron is gone, it is gone forever. This condition even has its own medical name: NSAID-induced nephropathy, a form of kidney damage caused directly and specifically by these pills. A study published in the New England Journal of Medicine, the most prestigious medical journal on the planet, found that regular NSAID use increased the risk of acute kidney injury by 58%. 58%. And regular use didn't mean abuse. It meant taking these pills consistently over weeks and months, the way millions of people with chronic pain do every single day. I want to tell you about a patient named Robert, 55 years old, construction foreman, strong man, hardworking man. He had chronic lower back pain from years of physical labor. His solution? 2 Advil in the morning, 2 at lunch, sometimes 2 more at night. He wasn't being reckless, he was just trying to get through his workday. When Robert came to see me, his creatinine levels were dangerously elevated. His kidneys were functioning at just 48% capacity. Stage 3 chronic kidney disease from ibuprofen. He had no idea. No one had ever warned him. He sat in my office with tears in his eyes and said, "Doc, I just wanted to stop hurting." And that's the tragedy of this pill. People aren't being careless. They're in pain. They're doing what they were told was safe, and they're paying for it with their kidney function. The fix? For chronic pain? Speak to your doctor about alternatives. Acetaminophen in controlled doses is significantly safer for kidneys. Physical therapy, anti-inflammatory diets, topical treatments. There are options, but taking NSAIDs daily for months or years is not one of them. Now, take a breath, because we are entering the top 2, and the intensity of what you're about to hear is going to be significantly higher. Number 2 is a medication that is prescribed to hundreds of millions of people worldwide. It's considered a first-line treatment for one of the most common conditions on Earth. And the way it damages your kidneys is so specific, so targeted, that nephrologists have a dedicated term for the destruction it causes. Number 2, certain diabetes medications, specifically older generation ones, and one class in particular. We are talking about metformin in patients with already compromised kidney function, and more critically, older sulfonylureas and some combination diabetes drugs that are still widely prescribed today. Now, before I explain, I need to be very clear about something. If you are diabetic, do not stop your medication based on this video alone. Uncontrolled diabetes destroys kidneys far faster than medication ever could. What I want you to understand is the interaction, the hidden danger that many patients are never told about. Here is what happens. Many diabetes medications, particularly older classes, are processed and eliminated through the kidneys. The kidneys are the exit route, the filtration system that clears these drugs from your body. But here's the dangerous cycle that almost no one talks about. Diabetes itself damages the kidneys over time, a condition called diabetic nephropathy. As kidney function slowly declines due to diabetes, the kidneys become less efficient at clearing these medications. The drug starts to accumulate in the bloodstream. Higher drug concentrations put more stress on the already weakened kidneys. More kidney damage means even less clearance. Even higher drug levels. It is a spiral, a biochemical death spiral, and millions of diabetic patients are caught inside it right now, without knowing. A major analysis published in The Lancet, covering data from over 500,000 diabetic patients, found that improper medication management in patients with declining kidney function was directly responsible for accelerating kidney failure in a significant percentage of cases. I remember a woman named Patricia, 61 years old, type 2 diabetic for 14 years, faithfully taking her medication every day, never missing a dose. Her primary care doctor monitored her blood sugar. Her endocrinologist monitored her glucose levels. But nobody was monitoring her kidneys closely enough. When she arrived at my clinic, referred by her family doctor after routine blood work showed abnormalities, her kidney function had dropped to 38%. Stage 4 chronic kidney disease, one stage away from dialysis. She was absolutely blindsided. She thought she was managing her condition perfectly. She thought she was doing everything right. "How did this happen?" she asked me. The answer was heartbreaking in its simplicity. Nobody checked whether her kidneys could still handle her medication load. The fix? If you are diabetic, demand a GFR test at every checkup. GFR stands for glomerular filtration rate. It measures how well your kidneys are actually filtering your blood. If your GFR is declining, your medication protocol needs to be reviewed immediately. Newer classes of diabetes medications, like SGLT2 inhibitors, are actually shown to protect kidney function. Ask your doctor if they're right for you. Now, we have arrived at the moment this entire video has been building toward. Number 1. The pill that more people take than any other on this list. The pill that is marketed as the safest pain reliever available. The pill that pediatricians recommend for children. That surgeons recommend after operations. That is handed to elderly patients in nursing homes every single night. The pill that, when taken in excess or combined with certain common habits, can devastate your kidneys in ways that are completely irreversible. Are you ready? Because what comes next changes everything. Number 1, are you ready? Because I need you to really hear this. Not just listen, hear it. Acetaminophen, known worldwide as paracetamol, sold under brand names like Tylenol, Panadol, Calpol, Excedrin. The pill that has been called the safest over-the-counter pain reliever in existence. The pill that doctors recommend when they want to avoid the kidney risks of NSAIDs. The pill given to pregnant women, to newborns, to elderly patients in care homes every single night before bed. That pill. And before you close this video, before you tell yourself this can't be right, I need you to stay with me. Because what the science shows about acetaminophen and kidneys is something the pharmaceutical industry has spent decades downplaying. Most people know that acetaminophen damages the liver in high doses. That warning is on the box. But what is not on the box, what nobody tells you, is what it does to your kidneys. Here is the science. And I want you to understand every word of this. When your body processes acetaminophen, your liver breaks it down into several byproducts. Most are harmless, but one of them, a highly toxic compound called NAPQI, is dangerous. In normal doses, your liver neutralizes NAPQI quickly using an antioxidant called glutathione. But when you take acetaminophen regularly, over weeks, over months, over years, your glutathione reserves become depleted. And when glutathione runs out, NAPQI has nowhere to go. It starts circulating, and it finds its way to your kidneys. Inside your kidney tissue, NAPQI triggers a process called oxidative stress. It attacks kidney cells at the molecular level. It damages the DNA inside those cells. It triggers inflammation in the delicate tubules, the microscopic channels your kidneys use to filter your blood. Over time, this leads to a condition called analgesic nephropathy. Kidney destruction, caused directly by pain medication. And here's the statistic that stopped me cold the first time I read it. A study published in the Archives of Internal Medicine followed over 1,900 patients over 14 years. Women who took acetaminophen more than 22 days per month had a kidney function decline rate that was 3 times higher than women who didn't take it regularly. 3 times higher. Not 10% higher, not 50% higher, 3 times. And another landmark study from Harvard Medical School, tracking over 5,000 patients, found that high cumulative intake of acetaminophen was associated with a 40% increased risk of developing chronic kidney disease. From the pill everyone considers safe. But the science gets even darker. Because acetaminophen is not just in Tylenol, it is hidden inside over 600 different medications, cold and flu remedies, NyQuil, Dayquil, Theraflu, Alka-Seltzer Plus. Prescription painkillers like Percocet and Vicodin contain acetaminophen. Sleep aids, allergy medications, migraine formulas. Millions of people are unknowingly double and triple dosing acetaminophen every single day, taking it in their pain reliever, their cold medicine, and their prescription pill simultaneously. And their kidneys are absorbing the full impact of every single dose. Now I need to tell you about Daniel. Daniel was 44 years old, a high school football coach, fit, active, no significant medical history. He had chronic knee pain from an old sports injury. His doctor told him to take Tylenol instead of ibuprofen, specifically to protect his kidneys. So he did, faithfully. 2 extra strength tablets 3 times a day, every day, for 4 years. He also took NyQuil occasionally for sleep, and when cold season hit, he'd take Dayquil throughout the day. Nobody told him he was stacking acetaminophen on top of acetaminophen. When Daniel came to me, referred after his annual physical flagged abnormal kidney markers, I ran a full panel. His kidneys were functioning at 41%. A 44-year-old man, healthy, active. A coach who spent his life telling young athletes how to take care of their bodies. 41% kidney function. He sat in my office completely silent for a long moment. Then he said, "I switched to Tylenol because I thought I was doing the right thing." I have never forgotten that sentence, because Daniel did everything he was told. He followed the advice. He trusted the system, and the system failed him, because nobody told him about the hidden acetaminophen in his other medications. Nobody explained the cumulative toxic load. Nobody monitored his kidneys while he was taking a pill that was supposed to be safe. And now Daniel manages his kidney disease with dietary restrictions, quarterly monitoring, blood pressure medication, and the constant shadow of knowing that dialysis may be in his future. From Tylenol. This is not about fear for the sake of fear. This is about the truth that millions of people deserve to hear. Your kidneys have no pain receptors. They cannot tell you when they are being damaged. They will silently lose function. 10%, 20%, 30%, 40%, and you will feel nothing until the damage is catastrophic. By the time symptoms appear, fatigue, swollen ankles, foamy urine, back pain, changes in urination, you may have already lost more than half your kidney function. And kidney function, once lost, does not come back. There is no kidney regeneration pill, no surgery to restore dead nephrons, no supplement that reverses analgesic nephropathy. What is gone is gone. The behavior change starts today. First, check every single medication in your home for acetaminophen content. Read every label, every cold medicine, every sleep aid, every prescription painkiller. Know exactly how much acetaminophen you are consuming across all sources. Second, never exceed 3,000 milligrams of acetaminophen per day. The old recommended limit was 4,000 milligrams. Leading nephrologists now consider 3,000 milligrams the safer ceiling, and lower is always better. Third, if you take acetaminophen regularly for chronic pain, weekly or more, tell your doctor. Request a GFR test and a creatinine level check every 6 months. Make your doctor monitor your kidneys. Don't wait for symptoms. Fourth, explore alternatives. Targeted physical therapy, anti-inflammatory nutrition, topical pain relief, acupuncture, mind-body pain, management techniques. These are not fringe ideas. These are evidence-based approaches that leading pain specialists now recommend as first-line options before reaching for any pill. Because the best pill for your kidneys is the one you don't have to take. Take a breath. I know that was a lot to take in. I know some of what you just heard may have shaken you. Maybe even scared you. Good. Not because I want you to live in fear, but because the right kind of fear, the kind that makes you act, can save your life. So let's bring this home together. Let's talk about hope. Because there is enormous hope here. And the fact that you watched this entire video means you are already ahead of millions of people who have no idea what you now know. Knowledge is the first step, and you just took it. Let's do a quick recap of everything we covered today. Number 5, calcium-based antacids like Tums and Rolaids. Taken excessively over time, they flood your kidneys with calcium, leading to dangerous deposits inside kidney tissue that can permanently reduce filtration capacity. Number 4, proton pump inhibitors like omeprazole and Nexium. Long-term use depletes magnesium levels, triggering chronic kidney inflammation and raising your risk of kidney disease by up to 50%. Number 3, NSAIDs like ibuprofen, naproxen, and diclofenac. These block the prostaglandins your kidneys depend on for healthy blood flow, starving and killing the nephrons that can never be replaced. Regular use raises acute kidney injury risk by 58%. Number 2, certain diabetes medications in patients with declining kidney function. The dangerous accumulation cycle, and where weakened kidneys can't clear medications efficiently, creates a biochemical spiral that accelerates kidney failure silently and rapidly. And number 1, acetaminophen, Paracetamol, Tylenol, Panadol, the most trusted pain reliever on earth, hidden in over 600 medications. Toxic to kidney tissue through NATHY accumulation and oxidative stress, linked to a 3 times faster rate of kidney function decline in regular users. The pill that destroyed Daniel's kidneys while he thought he was being responsible. 5 pills. 5 mechanisms of destruction. All happening silently. All happening right now in millions of people who have no idea. But here's what I need you to truly understand. You are not powerless, not even close. Your kidneys are remarkable organs, 2 fist-sized organs sitting quietly in your lower back, filtering 200 liters of blood every single day, processing every toxin, every medication, every chemical your body encounters. They have been working for you every second of every day since before you were born. They deserve your attention, they deserve your protection, and starting today, they are going to get it. Here is your complete kidney protection action plan. Starting tonight. Step 1. Do the medication audit. Go to your medicine cabinet tonight. Pull out every single bottle, every pill, every liquid, every prescription, and every over-the-counter product. Read the ingredient list on every single one. Look for acetaminophen, ibuprofen, naproxen, omeprazole, pantoprazole, calcium carbonate. Write down everything you are taking and how often. You may be shocked by what you discover. Step 2. Calculate your daily acetaminophen load. Add up every source of acetaminophen in your daily routine. Pain relievers, cold medicines, sleep aids, prescription painkillers. If your total is approaching or exceeding 3,000 milligrams per day regularly, that conversation with your doctor cannot wait another week. Step 3. Schedule a kidney function test. This is non-negotiable. Ask your doctor for 2 simple blood tests, a GFR and a serum creatinine. These 2 numbers will tell you exactly where your kidney health stands right now. Early detection is everything. Caught at stage 1 or 2, kidney disease is manageable. Caught at stage 4 or 5, your options shrink dramatically. Step 4. Hydrate deliberately. Your kidneys need water to flush toxins and medication byproducts from your system. Not coffee, not soda, not juice. Water. A minimum of 6 to 8 glasses per day. If you are taking any regular medication, increase that. Give your kidneys the tools they need to do their job. Step 5. Have the conversation. Book an appointment with your doctor and bring your medication list. Ask directly. Are any of my regular medications putting stress on my kidneys? Is there a safer alternative? Should we be monitoring my kidney function more frequently? A good doctor will welcome that conversation, and if they don't, find one who does. Step 6. Protect your kidneys through nutrition. Reduce sodium. Reduce processed foods. Reduce excess protein from red meat. Increase antioxidant-rich foods to berries, leafy greens, olive oil, beans. Manage blood pressure and blood sugar, the 2 greatest long-term threats to kidney health. These are not complicated changes, but they are powerful ones. Because here is the truth that I want to leave you with today.